All right, let's get into it. I want you to think about your brain for a second. Imagine it's got this incredibly complex, super delicate plumbing system inside, constantly circulating a special fluid that keeps everything cushioned and healthy. Now, what do you think happens when that system gets a clog, or just breaks down?
Well, that breakdown leads to a condition called hydrocephalus. It's basically a dangerous buildup of that special fluid, it's called cerebrospinal fluid, or CSF for short, right inside the brain. And when this delicate system gets all backed up, it creates this immense pressure on the brain tissue itself. And as you can imagine, that can be incredibly serious.
So in this explainer, we're going to break it all down. First, we'll look at the brain's fluid system and how it's supposed to work. Then, we're going to explore what happens when that flow gets blocked. After that, we'll cover how to spot the warning signs of that pressure building up, and finally, how specialists step in to fix the problem and restore the balance.
Okay, so first things first. Let's take a look at how the brain's fluid system is designed to work when everything is running perfectly.
It's actually this elegant, continuous cycle. See, this fluid, the CSF, is constantly being made deep inside the brain. From there, it flows through a series of chambers, called ventricles, that bathe and protect the entire brain. And then, it gets reabsorbed back into the bloodstream. It's this perfect loop: production, circulation, and then absorption, happening all the time.
So what happens when this perfectly engineered system goes wrong? Let's get into the different ways this can happen. The different types of hydrocephalus.
You really got two main types, and that plumbing analogy we started with is perfect here. First, you have communicating hydrocephalus. Here, the fluid is flowing just fine between all the chambers, but the problem is with absorption. It's kind of like having a faulty drain. The fluid just can't get removed properly. Then you have non-communicating hydrocephalus, and this one is exactly what it sounds like. There's a physical blockage somewhere in the pipes, like a clog, that's stopping the fluid from moving at all.
And these plumbing problems can come from a few different places. Some are congenital, which just means they're present from birth, often because of developmental issues like spina bifida. Others are acquired, meaning they develop later in life because of something like a brain injury, a serious infection like meningitis, or maybe even a tumor.
Now here's where it gets really interesting. There's a special case called normal pressure hydrocephalus, or NPH. This type mostly affects older adults, and it's a bit of a medical puzzle. Why? Because even though the brain's ventricles are clearly enlarged, the pressure reading isn't always high, but it still causes major problems.
So with all this pressure potentially building up inside the skull, how can we tell when it's getting to dangerous levels? Well, the body gives us some pretty clear warning signs.
And this is absolutely critical. The signs are totally different depending on your age. In an infant, their skull bones haven't fused together yet, so the head can actually expand to make room. You might see the head getting bigger really fast, or the soft spot on top bulging out. But in older children and adults, the skull is rigid. It can't expand, so all that pressure is trapped inside. And that leads to things like severe headaches, vomiting, and even vision problems because of swelling around the optic nerve.
And remember that special case we just talked about, NPH? Well, there's a classic, very memorable way to spot the symptoms. It's known as the triad: wobbly, wet, and wacky. Wobbly refers to trouble with walking, wet refers to urinary incontinence, and wacky refers to cognitive decline. It's a simple phrase that helps doctors quickly zero in on potential cases.
So to really confirm what's going on, doctors obviously need to look inside the brain, and imaging is absolutely key here. A CT scan can quickly show if the ventricles are enlarged. For infants, a simple ultrasound right through the soft spot can do the trick, but an MRI? That gives a much more detailed picture. There are other tests too, like a lumbar puncture, where they remove a little fluid to see if symptoms get better, which can help diagnose specific types like NPH.
But really, the gold standard for diagnosis is an MRI. It is just incredible. It doesn't just show the fluid buildup and how much the ventricles have expanded. It can often pinpoint the exact location of the blockage, and that, of course, is crucial for figuring out the best way to treat it.
Okay, so you found the problem, you know where the clog is. How do you fix it? Well, this is where neurosurgeons basically become master plumbers, stepping in to relieve that dangerous pressure and get the brain's delicate balance back on track.
The most common solution is an amazing little device called a ventriculoperitoneal shunt, or VP shunt. It's basically a sophisticated internal drainage system. A tiny flexible tube is placed in one of the brain's ventricles. It's connected to a special one-way valve that controls the flow. And then another tube is tunneled just under the skin to drain all that excess fluid safely into the abdomen, where the body can just harmlessly absorb it.
But a shunt isn't the only tool in the toolbox. For certain kinds of blockages, surgeons can perform a procedure called an endoscopic third ventriculostomy, or ETV. Now, instead of draining and rerouting the fluid to somewhere else, the surgeon uses a tiny camera to go in and create a new little pathway that bypasses the clog entirely, allowing the fluid to start flowing normally again.
Now, it's really important to know that while these treatments are absolute lifesavers, they aren't without risks. Shunts can get blocked or infected. Sometimes they can drain too much fluid, or not enough, which creates a whole new set of problems. This is a lifelong condition that requires really careful, ongoing management.
But I want to share a really crucial message of hope here. For those older patients with normal pressure hydrocephalus, the condition is often reversible. It's incredible. If it's caught and treated early with a shunt, many of those debilitating symptoms can be dramatically improved or even disappear, giving people their quality of life back.
And that right there is the bottom line for all types of hydrocephalus. If there's one thing you take away from this, it's this. The sooner it's diagnosed and the sooner it's treated, the better the outcome. Timely intervention can make a world of difference in protecting the brain.
And this brings us to our final thought. We know for sure that early treatment is the key, but as our technology and our understanding of the brain just keep getting better, you have to wonder, what does the future hold for managing this incredibly complex lifelong condition?